Dr. St. Surin Lord is a fellow of the American Academy of Dermatology, as well as the American Academy of Cosmetic Surgery and the American Society of Dermatologic Surgery. She serves as an assistant professor of dermatology for Howard University, and has been a sought-after speaker at national conferences. She also shares her expert knowledge in professional publications. Voted a top doctor in the DC metropolitan area, Dr. St. Surin Lord's philosophy is that each patient should leave her office feeling better about him or herself. Thank you, Doctor, for taking time from your busy schedule to do this recording with us. How is Coolsculpting differs from other fat reduction treatments?
There are so many out there, but what makes Coolsculpting different? Coolsculpting by Zeltiq, the company that makes Coolsculpting, is the only one that actually uses cooling. There are other procedures that use heat. I know some people have heard of Sculpture, and that's heat, and that's fat necrosis, which is, just destroying the fat cells, but in a different way, heating them up and kind of like charring them and burning them. It's a different method, and every method is different. Some are more efficacious than others. Some are more work a little more rapidly than others. Some show better results. It depends on the person. And then there are methods that employ radio frequency, and there are so many methods of fat loss out there. And then of course there's suction. With liposuction. One thing I do want people to understand, though, is I do see patients who have had abdominoplasty or tummy tucks. Now, with abdominoplasty, remember, it's a tightening of the muscle and a reduction in the fat by excising or removing the extra skin that may contain extra fat. But it's not a method of fat loss. So sometimes I'll see patients who have had these procedures, and later on they're saying, you know what, I still have this fat here, and that's okay. We can remove it with Coolsculpting. But what makes Coolsculpting different, it is that it is the only one that employs fat. It's been around on the market for a very long time, since 2009. The company does invest in research. Again, over 1.5 million treatments worldwide, and I think it's probably even higher now. And Coolsculpting actually does direct-to-consumer marketing, where a lot of people are coming in now saying, oh, we know about Coolsculpting, we've read about it, and we're, it's safe, it's effective, I don't have any downtime, and I can come in and get it done. So I think that, that is the biggest thing that differentiates Coolsculpting from the others. But I think there are so many more benefits to Coolsculpting. It can definitely guarantee and stand by the 25% reduction in fat, but a lot of times we see more reduction. It's just that since the study showed 25%, that is what Zeltiq and Coolsculpting stands firmly on. I've seen a lot of patients do even better. So I think what's wonderful is to have a method that's tried and true. It's nice to have a piece of technology that I can really hang my hat on. I know it works. I know it's effective. And so that's what makes Coolsculpting stand out from other procedures.
Can the Coolsculpting procedure reduce fat anywhere on my body?
Coolsculpting will probably reduce fat anywhere that you put it, because remember, if you can pinch the fat, you put the instrument on there, the suction cup, it'll suck it up, cool the temperature, destroy the fat cells naturally. And having seen this, that's why the Cool Mini came out. The Cool Mini came out for submental fat, or the chin fat, the waddle, the turkey neck. We've heard it called so many things, but it's a smaller piece. So it took all the technology that they had in the cups that were big enough for abdomen, small abdomens, larger abdomens. We even have a large piece that we call the Cool Max. It took all that technology and it squeezed it into a tiny little piece for the chin fat. So yes, you can probably use Coolsculpting anywhere. The FDA has cleared it for certain areas, and those areas that it was cleared for are the chin fat, the submental fat, the inner and outer thigh, the abdomen, the love handles, the back flanks, any flanks, any love handle part. So those are areas that, you may say, oh, it's FDA cleared for that, but understand that a lot of times we do things where they work because it's safe and effective. It doesn't mean that, oh, if the FDA didn't approve it for there, we definitely can't do it there. It's just that, yes, the FDA said it for it to be done there, but there are other places where it can be employed safely. And as more research comes out, we do more areas. And so they're just always coming up with new things. And this is a piece of technology that's wonderful to have in the practice. We love it because every year we're finding out there's something new that we can use it for. And there's an article and there's this, things that you can do with Coolsculpting. The other thing that we use Coolsculpting for, believe it or not, is male gynecomastia. That is the increase in fatty tissue on the male breast. So instead of going in and having surgery and removing the fatty tissue, or anything, or the fatty tissue that's there, that's giving the male breast a more feminine appearance because it's fat, we can actually employ Coolsculpting in that area and actually get the male breast to look more like the male chest. So again, there are so many ways to use this technology. It's amazing. And the more I read the papers and I do the research and I see the science, it's pretty good.
I don't like my double chin. Can the Coolsculpting procedure help me lose it?
Yes. Cool Mini, when it came out, it was really exciting. We were one of the practices that were on the waiting list to get it. We were like, okay, we're purchasing it, we're ready to go. Because in this day and age of social media and selfies, everybody's always taking a selfie. And then, with Instagram and all these other things, many people have been hesitant to take selfies because of that double chin, or to take a profile shot. It's always, okay, what's my good side? Take it from the front, don't take it from the side. And so, yes, Coolsculpting is very effective for chin fat. Coolsculpting actually works pretty fast for chin fat. The majority of my patients who get Cool Mini for the chin tend to see results by the time they're back for their 4-week appointment. And the 4-week appointment is just a medical appointment to make sure that everything's well, the numbness is subsiding, et cetera, et cetera. And they're actually seeing results. And we're like, oh, well, let's get some, after pictures because you actually look so great. Of course, we still have the 3 to 4 month window to see results with the Coolsculpting piece for the chin fat, but it can happen sooner. I've actually gotten Coolsculpting of the chin fat, and it depends on how ample or robust of an area that we start with. That's what determines how many treatments we get. The first time I got the Cool Mini done, I only got the center part, the centerpiece, and then having gone to Coolsculpting University and done more advanced training, I then went and we came out with the Dual Mini. When they came out with the Dual Mini, I said, oh, this is awesome. So what we did is we did it like 2 Olympic rings, where you have it. You have 2 pieces like this. So the first piece would come here, the second piece would come there, and you get the entire chin area, and that's really dramatic. And many of my patients, they see their result by 1 treatment. Again, it depends on the size of the neck, but we've had some really heavy necks, male necks as well, that do so well on Coolsculpting, and especially with the Dual Mini. So will you see results? Yes, definitely. And guess what? It's in 45 minutes. You spend more time than that in traffic or, waiting on the hairstylist or at the grocery store sometimes. So it's exciting to have it and to know that patients are happy and they're coming back for it and they're telling their friends and family. So yes, in conclusion, it really is pretty effective. And you can say goodbye to the chin fat forever.
How is the Coolsculpting procedure different from Kybella and chin fat treatments?
They employ different things. Kybella is injections of deoxycholic acid. We know for a while that in the body that chemical is naturally there, and what it does is dissolves fat. So Kybella is actually injections that dissolve fat and melts fat away. Coolsculpting pinches the fat, freezes it, and destroys the fat cells that way. So I actually use both technologies. I have patients who have smaller chin fat, smaller pockets. Let's take, for example, someone in her 60s who may not have that much fat, but just has a little bulge there. Sometimes we do a little Kybella, and that takes care of it, and it's over. If there's a little more fat, I might do Cool Mini. If a person is needle phobic, then I'll do Cool Mini, because if they're afraid of needles, then we're not going to do Kybella and inject. So what I love about them is they're both effective, they're different technologies, but you get the pick of the litter, and there's something for everyone. So what makes them different? Kybella melts fat, Coolsculpting freezes fat. They're both effective. Kybella, you may need 2 treatments. Some people with more fat or more stubborn fat, a larger area, may need 3 treatments. Coolsculpting, you generally need 1. If you have more of an ample neck, you may need 2. So different technologies, different ways of dealing with the same problem, but both effective.
Can I return to normal activities after my treatment?
Definitely. You can get Coolsculpting done, get out of the chair, put your clothing back on, and go back to work. And no one will ever know that you've had anything done. The first time that I got Coolsculpting of the lower abdomen. I actually saw my patients afterwards. It was on a little break, which doctors rarely get, but we take advantage of those little breaks. And I did my Coolsculpting. I saw my patients, went to the grocery store, and did homework with my kids. And it was great that I could do all those things and not worry about a garment or worry about pain medicine or post-procedure care or anything. And that's just me. My patients, and when they talk about it, a lot of times, remember, they can't take time off from work, or they have deadlines to meet, so they can go straight to work. Or if they're caregivers, they can go straight to caring for their loved ones. If it's somebody running their own company, he or she can go back to doing what they need to do. Again, it's their livelihood. So what's wonderful with Coolsculpting is that it does not impede anything that you do on a day-to-day basis. So there is no downtime. We can, really say that there's no downtime. Now, if you feel numbness, the numbness is transient. It goes away. It's just that it's a muted sensation, I like to say. So you may not necessarily feel that somebody's is rubbing really hard, but it'll feel like a light touch. It's more of a muted sensation. And after 4 to 6 weeks, that goes away. The cramping, that starts at day 4, and sometimes if I need to prescribe something for that, or sometimes it's even just a pain patch, but people still go on with their day-to-day activities. So it's wonderful that I can say that, yeah, you can return to doing exactly what you were doing right before you came in.